My name is Simon Szczepaniak. I'm a former cancer patient at Charing Cross. I had two cancers. I'm 38 years old. When I was diagnosed, it happened very quickly and there was no time for emotions. I was diagnosed on a Thursday and I started chemo on a Monday, the following Monday. It was that quick, and when I was diagnosed, they found out that the cancer was spread extensively. I had a big tumour, so they had to act very quickly. So things were moving fast, and it was almost like watching myself in a film. I became detached from it. The most difficult emotional moments were following the treatment, when things calmed down and I had a chance to get my life back together. And I found out that it wasn't as easy as people said. When you get diagnosed, when I got diagnosed and my friends found out about it, I got about 5 copies of Lance Armstrong's book. And in it, his recovery is very quick and he becomes a cycling champion, and it's all very easy. It's not so easy in real life. I had a very physically demanding job. When I went back to my job, I found I couldn't do it. On top of that, the constant worrying about the cancer coming back and whether my job and the stress of it was going to bring the cancer back, that was very emotionally stressful. And then my cancer did come back, and that was a very hard blow. My worst fears were confirmed. The things that the doctors said were very unlikely to happen happened. Which led me to become very angry with the world. I had to move back with my parents, which wasn't easy, and I had many arguments. And my coping strategy, obviously, all the stress of it all, and the arguments, and the fact that I couldn't relate to anyone anymore. I had friends coming complaining about their personal relationships and things like that, and there I was, going for my 36th radiotherapy session. So all these things culminated in arguments, especially with my mother, and that led me to withdraw from everything. I had arguments, I moved out, I didn't speak to my parents for a long time. All the friends that irritated me, I sort of pushed aside. And eventually I ended up with no friends and living by myself as a recluse. I think it's just people expect you to get on with things. My family, which is the reason why I isolated myself from my family, they all read Lance Armstrong's book and they all expected these things. In fact, I had my sister's husband say, well, you've been given a second chance, why aren't you doing anything? Why? And I thought, well, you know, you had a little fever and we had to drive you to the hospital and you were shaking like a little kitten. And, and here you are telling me how I've been giving a second chance and how I should be, you know, going on my way to becoming a world champion cyclist or something like Lance Armstrong. It's not that easy, you know. Chemo and radio and all the treatments takes it out of you. You know, you're physically tired a lot of the time, and so yes, so I didn't want to explain it to everyone. It was just easier to pretend that everything was fine. And before I knew it, years and years had passed, and you know, and my coping mechanisms, which were at the time I thought were fantastic, were not really doing anything. I wasn't moving forward, and that's when the depression set in, and the realization that I was in a spiral, and they were not helping me. They were making things worse. You know, whenever I went for checkups, it was all smiles and jokes and things like that. Yeah, so it was only when I had when I had the medical emergency, I let my guard down a little bit, and then I started speaking about these things, but you know, it took years. I had a kidney stone, And when that came about, I had to go and see all the cancer people because they were worried that my cancer was back. So all the scans and things started again. And there was a new registrar at Charing Cross, and she started asking about my life, and I was very evasive. I didn't say anything, and she was worried about my long-time unemployment. And she started asking questions, and I had a little bit of a I let my guard down a little bit, and I started telling her, and she said, well, maybe you should see a psychologist. You know, these things are not normal. To me, there were these coping strategies of isolation were quite perfectly fine, but obviously not. They did manifest themselves, you know, when you're isolated, you do get, your life is sort of meaningless and devoid of anything really. So I did have bouts of depression, but you know, I thought that was just part and parcel of having gone through what I had gone through. And the realization that I had to get my life on track just became very overwhelming. You know, everything I did or wanted to do had to be started from scratch. I didn't have a job. I knew the job I knew previously or did previously. I couldn't do it because I was physically unable because, you know, of the cancer treatment and the fact that, you know, I was a builder and it's a very physically demanding job, and I couldn't do it. So I had few friends, and I had to rebuild my relationship with everyone, including my parents, which I did. You know, I speak to my mum and dad now, which is nice. Getting back into normal life, that became something that became overwhelming for me, which again made me fail and retreat back into my bubble, and it was like a vicious spiral. Well, by that time, when I spoke to the registrar and I started letting on that things were not so well, I realized, yes, this probably needs to be done. I can't, you know, cancer's upheaval, the aftermath is very difficult. Getting your life back together is very difficult. Yeah. By that time, I came to the realization that my own little bubble, my way of coping with things, was not going to lead anywhere. It wasn't good. It was, like I said, it was just a spiral. She suggested I see a clinical psychologist. She made an appointment. I got a phone call from Troy's office. I told them what the problem was. By that time, I started talking about my problems, so I told the receptionist lady what my problem was. She said, yep, come over, made an appointment, and I came over. So, yeah, I wish I knew about this earlier. You know, I wouldn't have things get so out of hand. So I came to see Troy. Plus, I needed someone to talk to about these things to someone. I hadn't ever. Whenever I spoke to anyone about these things, they said, well, you know, you should get on your bike and cope. Do a Lance Armstrong. You did it. Oh, why don't you do it? Well, the first thing I did was tell him about my problems. And that was like getting an enormous load off my mind. It's something I've been carrying for years and years and years, trying to cope with it. And just speaking about it was the most... the relief of it was the most amazing thing. I felt like a ton had been lifted when I left the office. And then as we worked through my problems, my issues, and it helped me, you know how you speak about things, you organize them in your mind, you almost think about them. And when I tried to do it by myself, I was just overwhelmed by it. The enormity of the things I had to do. Simple stuff that people would think, yeah, go and get a job. You know, stuff normal people think it's normal. For someone who had been in isolation for a long time, these things are insurmountable. They're impossible to cope with. But with Troy, you know, we did exercises and worked through my issues one by one, and you know, I no longer feel overwhelmed. Things can be broken down and worked on little by little, and slowly I think, you know, things are getting better. My coping mechanisms were not working. I wasn't sure how to get out of it. I was getting more and more depressed. I don't know how it would have ended. Nothing good would have come out of it when you're trapped like that. You know, what are the options? Suicide was on my mind, but but I knew I had to get help before I got to that point. I couldn't have done it to Dr. Savage, who was my oncologist, because he put so much effort into saving my life. I couldn't have done it I couldn't just, you know, drive off a cliff or something. It would have killed my mother. I imagine if Dr. Savage found out, he would have been angry as hell. But luckily, I was given help, and now things are looking positive. Issues are being worked on, and I feel, yes, things are better. Cancer is a life-changing thing. The diagnosis can be very brutal, and the treatment can be very difficult. I cannot imagine a person who would not be impacted by a cancer diagnosis. The advice I would give, if you find your life going awry, going sideways, is ask for help. There are people there, professionals that can help you and put you back on track. The people around you, they're not trained. Very often for them, it's the first time they experience something like this. Your parents, your family, your friends, yeah. So it's. I would advise go see a professional, see a clinical psychologist. It's very easy to get into the mire of the clinical side of stuff. Things happen very quickly. When I was doing my chemos and things, it was like a 18-hour-a-day thing with the blood tests in the morning, then the infusions, and then rest at night. And there's very little time to think about emotional stuff, but it does build up. And I think it's important. It's another side of cancer that needs to be addressed, I think. Because then you'll end up with you'll have to put pieces of your life back together. And if you have this huge thing there that you may not always be able to cope with it. There's a way of behaving, maybe saying, yeah, keep calm, carry on, put a brave face on. Well, there's no need. I think it's if you do have a need to speak about emotional side of things, you should talk about it. And there are people trained that will help you in that aspect of cancer care as well.